On this episode of the ASC Podcast with John Goehle, we discuss the guidance from CMS on May 1st related to expiration of the public health emergency and changes to the vaccine mandate. We remind our listeners about the upcoming ASC Quality Reporting Deadline in May. And in our focus segment, we discuss the evolving impact of technology on financial management and FINTECH with our friends at triValence.
Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. We'd like to thank our sponsor of this episode, triValence. triValence offers a comprehensive next-generation ASC solution that optimizes payment and supply chain performance, enabling actionable data insights. For more information about triValence, visit their website at trivalence.com. That's trivalence.com.
Welcome to episode 186 of the ASC Podcast with John Goehle for May 2nd, 2023. We're recording from our studios in Spencerport, New York. This is Sue Cronkite, Chief Researcher for the ASC Podcast with John Goehle and Operations Manager for Ambulatory Healthcare Strategies. We would like to remind our listeners that the ASC regulatory environment is a rapidly evolving landscape, and the material presented in this episode is based on the most current information available as of the date of the recording. As such, it's important to recognize that this information may be subject to change, and we advise all ASCs to stay up to date with the latest regulations and guidelines issued by the relevant regulatory bodies. And joining me today is John Goehle, the owner of Ambulatory Healthcare Strategies and one of the most respected experts in the ambulatory surgery industry. With over 30 years of experience, Mr. Goehle has authored over 10 books on the ASC industry and is a sought-after speaker on regulatory accreditation and finance issues.
So our disclaimer there about reminding our listeners that they need to check the regulations in between episodes here is probably extremely important given the topic we're talking about today. So, yes. Sue, we were delivering Rosie's last puppy. We had one puppy left, and it was about a 7-hour round trip. And during that time, the news broke of the new quality, safety, and oversight guidance memo that was issued on May 1st related to the guidance for the expiration of the public health emergency. So as we've talked about before and what we've kind of mentioned quite a bit in our conferences is that when CMS decided to require all healthcare providers to be vaccinated against COVID-19, they built it actually in the Medicare regulations, which means that they revise the infection control section of those regulations, which is kind of a permanent thing.
Yeah, it's usually kind of set in stone. So we really thought it might never go away. Right.
And we knew that something was going to have to happen here, but we're not quite sure how they're going to do it.
Yes.
And this QSO standing for Quality, Safety, Oversight, memo is the first step in CMS trying to reverse those regulations. So, it's going to result in some confusion until the interpretive guidelines come out that will help us to understand how those changes have occurred. Yeah. And we have to remember also that state regulations, if they are stricter, will supersede the federal regulation. So it's important for you to keep an eye out since many of these states are changing their regulations. For example, 10 minutes before I recorded this episode, I checked a bunch of states to see where they are. Yeah. New York and New Jersey, it's still in place. Massachusetts, it looks like it's removed. California, as best I can tell, it's been removed. But you've got to stay on top of these things because just because the federal regulation is disappearing doesn't mean the state regulations won't, will disappear, though I suspect that they will.
I think eventually they'll follow suit, but
exactly.
Until they do, you have to always the most stringent regulations.
Right. And of course, read the nuances of it, too, because that's what's very confusing here. So what we're talking about is the Quality, Safety, and Oversight Memo, QSO 23-13-ALL, and it's entitled Guidance for the Expiration of the COVID-19 Public Health Emergency. And we'll provide a link to this information in the show notes here. So just a little bit of a background. The Social Security Act, Section 1135 waiver, emergency waiver for healthcare providers, will terminate with the end of the COVID-19 public health emergency on May 11th, 2023. So we're recording here on May 2nd. This QSO came out yesterday, May 1st, and we know that in approximately 9 days, the public health emergency, unless something changes, the public health emergency will change. And certain regulations or other policies, including the interim final rules with comments, are going to be modified with the ending of the public health emergency. And certain policies, such as the acute hospital at home initiative and telehealth flexibilities, have been extended by Congress through December 31st, 2024. But now we want to talk about what's going on in the ambulatory surgery area. And again, a little bit more of a background. November 2021, CMS issued an interim final rule. Isn't it interesting how we got all these confusing terminologies like interim final rules? CMS 3415 IFC, which required Medicare and Medicaid certified providers and suppliers to ensure that their staff were fully vaccinated against COVID-19. I.e. to obtain the primary vaccination series, which was a critical step to protect patients. And on April 10th, the president signed legislation that ended the COVID-19 national emergency effective May 11th, 2023. In light of these developments and comments that CMS has received related to the interim final rule, CMS will soon end. So this is the big news. CMS will soon end the requirement that covered providers and suppliers establish policies and procedures for staff vaccination. And in my notes here, this is bulleted or is bolded. CMS will share more details regarding ending this requirement at the anticipated end of the public health emergency. So within the next 9 days, we should get additional information. And of course, we will pass that on to you with an episode as soon as we get that information. And CMS in the QSO did remind everybody that the strongest protection from COVID-19 is the vaccine. Therefore, CMS encourages everyone to stay up to date with the COVID-19 vaccine.
Yeah, so the problem is we really don't know how to implement this, what exactly everybody's supposed to do.
Right.
It's just, it sounds like good news. We're heading in the right direction, but we have no real definite answers right now on how to proceed with this.
Right. And as we're sitting here on May 2nd, waiting for the May 11th expiration and waiting for additional guidance, don't change your policies yet. Certainly don't start, hiring people that are not vaccinated. But we can anticipate that this is going to happen, and you can start, considering how that's going to change your policies, your recruitment, et cetera. So what's going to happen is this is all going to result in changes to 416.51, the conditions for coverage for infection control. And we're referring specifically to the standard related to Standard C, which is related to COVID-19 vaccination of staff, and, of course, the associated interpretive guidelines. So CMS has got a lot of work to do between now and the 11th to reverse this information and provide guidance to surveyors as they go out and do the survey. Now, the QSO also referred to a couple other things that have been included in the regulations over time. One of those relates to the emergency preparedness program. And you might remember that the training and testing program exemption was in play. In other words, if you actually implemented your emergency plan, you're exempt from doing ongoing testing of that plan for a year after the plan was implemented. And of course, now that the plan has been implemented, assuming that you did indeed implement the emergency plan, you're not going to be exempt from the testing, meaning that you're going to have to go back to doing external and internal disaster drills. And CMS says providers and suppliers are expected to return to normal operating status and comply with the regulatory requirements for emergency preparedness with the conclusion of the public health emergency. And this includes conducting testing exercises based on the regulatory requirements for the specific provider types. And when it comes to outpatient providers, that means that the provider supplier must conduct either a full-scale exercise or an exercise of choice within its annual cycle for 2023. if scheduled to conduct a full-scale exercise within 2023. And the provider or supplier must conduct the exercise of choice if scheduled during the annual cycle for 2023 and resume the full-scale exercise requirement in 2024. So basically, we're going back to what the regulations stated right in the conditions for coverage. Mm-hmm. Now, in this QSO, they also talked about the temporary hospital conversion. Many of those temporary hospitals have now converted back to ASCs. So just to remind everybody, CMS allowed currently enrolled ASCs to temporarily enroll as hospitals and provide hospital services to help address the urgent need to increase hospital capacity to take care of patients during the public health emergency during the COVID crisis. As of December 1st, 2021, no new ASCs were allowed to enroll as hospitals.
Have you seen any numbers on how many did that?
No.
Couldn't have been too many.
No, and I think we did an interview with Bill Prentice where he talked about it, but we're not talking about hundreds of places. I think it's less than 100 did convert. So the QSO does refer you to go back to QSO 2203 for more information. But ASCs must decide either to meet the certification for hospital, in other words, convert to a hospital permanently, or to return to ASC status when the public health emergency ends. If they choose to return to the ASC status, they can only be paid under the ASC payment system for services under the ASC covered procedures list. So, as we mentioned, you can convert back to an ASC. So basically what they're saying is that you'd have a voluntary termination of the ASC's temporary hospital status. And the temporarily enrolled hospital must submit a notification of intent to convert back to an ASC to the applicable CMS survey and operations group, in other words, your local CMS group, on or before the conclusion of the public health emergency. So you have until May 11, 2023 to email or send a mailed letter to your local CMS office to convert back to the ASC. If you do decide to convert to a hospital, I can't imagine many ASCs doing this, but if you do,
a simple process.
No, not at all. And actually, it does talk about what the process is. So the conversion to the hospital, if the ASC wishes to participate as a hospital, it must undergo the hospital enrollment process by submitting a Form CMS 855A, unlike the 855B that we use for ASCs, to begin the process of enrollment and initial certification as a hospital on or before the conclusion of the public health emergency on May 11th. An initial certification hospital survey, either done by the state agency or by an accreditation organization, will be conducted to determine compliance with all applicable hospital conditions for participation before CMS issues a final determination letter for Medicare participation. So similar to how ASCs become certified, if you decide to convert to a hospital, you're going to have to go through all of those conditions for participation and meet all of those prior to becoming permanently certified as a hospital. And keep in mind, obviously, the hospital conditions for participation are much more complex. The surgery regulations are more complex than the surgery regulations within the conditions for participation. But as a hospital, you've got far more regulations that you have to deal with, including, having things like social, work departments, et cetera. Also, another interesting thing that we have to remember is anesthesia services are going to change. So 482.52 waived requirements that a CRNA is under the supervision of a physician, and the waiver of this requirement ends with the conclusion of the public health emergency. However, this doesn't change those existing regulations that allowed ASCs in states where the governor has allowed an exemption to the physician supervision requirements. So if you're in a state that is in that situation, you are allowed to continue not having a physician oversee, but otherwise you're going to go back to requiring the physician to oversee that CRNA. Now, Sue, in preparation for this podcast here, I did try to look up changes to the NHSN COVID-19 reporting requirements. And as of the recording, which is, 5:30 today, I don't have any update on that. I am going to provide a link to where any updates will be on the on the NHSN website. So I would encourage you to kind of look at that on a regular basis just to make sure that you're revising your reporting to take into consideration the new definitions of what fully vaccinated will be. And again, if you didn't catch our last episode 185, we did talk about the changes that CDC has made to those recommendations. And you need to make sure that you're up to date with the reporting requirements as they will be changing. And lastly, before we get into our focus segment, don't forget the ASC Quality Reporting requirements are due May 15th. As you all should probably be aware, or hopefully are aware, CMS Quality Net reporting will be due on May 15th. The reporting is done through the HARP system, that's capital HARP system, which you should already have a username and password for. I'll provide a link to that in case you don't, and if you don't, you're already going to have some significant problems. So just a reminder, the following ASC quality indicators are due for reporting by May 15th to QualityNet. ASC 9, which is appropriate follow-up interval for normal colonoscopy in average risk patients. ASC 11, cataracts, improvement for patients' visual function within 90 days. And this is a voluntary. I really don't recommend that you do this reporting. But that's voluntary for reporting after cataract surgery. So again, ASC 11 is voluntary. ASC 13 is mandatory, and that is normal thermia reporting. And ASC 14 is required also unplanned anterior vitrectomy. So ASC 9, ASC 13, and ASC 14 reporting is required by May 15th.
So what if you're not a GI center? Do you still have to do anything with number 9?
Yeah, it's a good question because even if you don't provide, like ASC 9 is only for GI centers, ASC 14, unplanned vitrectomy, is only for eye centers. Yeah. So if you don't do any of those, you still report. You have to report 0 for those. So good question. The following measure is also due to be reported through NHS and SAM's system for quarter 4 2022, as we were just talking about. ASC 20, which is the COVID-19 vaccination coverage among healthcare personnel. And as hopefully everybody knows by now, you report that through NHSN, through SAM's, not through QualityNet. Just a reminder, ASCs that do not meet these program requirements, which include reporting a quality measure data for the ASC Quality Reporting Program, may receive a 2% reduction in their ASC payment updates. So there's a significant penalty for not doing this. So, Sue, technology has changed in the way finance works and is having a major impact on the way that we do business, and it's starting to impact ASCs. FinTech is a term used to describe the intersection of financial services and technology, and it refers to the use of technology to improve and automate financial services and processes, including banking, lending, investment, payments, insurance, and wealth management. So obviously, this is going to have a big impact on ASCs. FinTech includes a wide range of technologies such as mobile banking apps, digital wallets, peer-to-peer lending platforms, blockchain, robo-advisors, and artificial intelligence, among others, which is getting an awful lot of attention right now. And FinTech has disrupted traditional financial services by offering faster, cheaper, and more accessible financial products and services to consumers and businesses. And like many of you, before I did research on FinTech, I knew nothing about it, didn't even know the term. So now I know far more than I perhaps ever thought I could possibly learn about it after this interview that's coming up. FinTech is a rapidly growing industry globally with significant investments being made in innovative technologies that are transforming the financial sector. So last month, we spoke to our friends at triValence, which is indeed a FinTech company, about FinTech, and we'll have that interview after we take a short break.
Do you work long hours at your ASC, ordering from multiple vendors or managing back orders? Do you manually track POs and invoices? Do you need help sifting through paper to find payment discrepancies? Most ASCs are understaffed, overworked, and wear multiple hats, which leads to burnout. triValence launched an intuitive procurement-to-payment solution that optimizes your ASC's performance and removes the frustration from daily tasks, allowing for a happier, more productive staff. The triValence solution streamlines the disjointed supply chain in your busy surgery center, from ordering supplies to managing your purchase orders and invoices to making payments. The platform provides a robust dashboard with actionable reporting and lets you track your spending down to the penny. Visit trivalence.com to schedule a demo or learn more about this all-in-one solution. That's trivalence.com.
So I'm here with my friends over at triValence. I'm going to let them introduce themselves, talking about what the state of transaction processing and a new term which we're going to define in a few minutes called FINTECH. So why don't you introduce yourselves first?
All right, I could go first. So my name is John Mwangi. I'm VP of FinTech Strategy and Partnership here at triValence.
John, Brian Goehle. I am head of operations, customer success, and product management here at triValence. And I had the opportunity of spending about 25 years in healthcare, including around 15 running surgery centers prior to joining triValence and pairing up with John to help solve some significant issues in the FinTech ASC space.
Thank you so much, John and Brian, and welcome to the ASC Podcast. It's great to be talking about a topic that is going to probably become a lot more important. Well, definitely become a lot more important as we move forward. And so just following up on a conversation we had a couple months ago with triValence regarding supply chain. Today we're going to focus a little bit more on the financing side of the transaction processing side, and a term that I had never heard of before I met you guys, and that's FinTech. So why don't we just start by talking a little bit about what the current state of transaction processing and indeed what transaction processing is in the first place.
What I think is really important for us to do is set a bit of the stage around the ASC industry as a lead into appreciating FinTech across the U.S. as well as how it's going to pertain to the surgery center. So if I think about my personal journey before joining triValence and running ASCs, there's really two critical components to supply chain and expense management, right? It's how you interact with suppliers, and I know there was a recent podcast about supply chain, but then there is and that's for the procurement side. The second component is once you procure products, how do you actually manage accounts payable and for them AR, and how do you actually get them payment? In my personal experience, that was managed through a lot of manual processes, whether that's paper invoices, emails, lots of manual labor to get that into some system that then allows you to choose when and how to pay suppliers. And traditionally in ASCs, what I was used to is that essentially means I am writing checks, no different than the checks I learned when I got my first bank account. And that is very different than your personal life experience, right? Where you can use very simple apps, whether that's Zelle, Venmo, Cash App, right, to pay somebody for a service. And one of the reasons I joined triValence is what I appreciated in my prior life is the amount of manual effort, the lack of data, and the lack of real-time visibility that process has. And FinTech, which John can talk more about, provides a lot of tools to solve some of those common issues for surgery centers. So John, I'd love to hand it over to you and give a bit of a background on FinTech.
Yeah, absolutely. And, we talk about the term FinTech. Really what we are talking about conceptually, it's how we can use technology to help businesses improve how they make payments and to help consumers improve how they make payments and how they manage their finances. So as much as we throw around the term FinTech, really at the core of it, what we are describing is how do we use technology to make our financial lives easier. And one of the examples I always like to use, going back to what Brian is describing, we have all used FinTech products. We probably just have not called them FinTech products, right? So the example I'll give you, John and Brian, is every time you use one of these ride-sharing apps, whether it's Uber, whether it's Lyft, or whether it's some of the other apps in other parts of the world, that's actually a FinTech product you are using, right? And to use the example that Brian was giving, your expectation as a consumer when you ask for a ride-sharing app, you expect the driver to show up. You expect to be able to track your journey. You expect to get to where you're going. And at the end of that ride, you just expect to leave the car and go to your destination, right? You don't expect to have 5 different apps to track your ride or manage receipts and do mapping. You expect all that to be delivered to you in a convenient package. So when we say FinTech, I want you to use that as an example. If you have used a ride-sharing app, that's really what we are describing. How do we use technology to make your financial life easier and more integrated.
Yeah, I mean, it's a great example for me because I just came back from a trip where I used Lyft, in my case, to go back and forth. And the way it's set, just to kind of give an example from my own life, I used the app, I paid the tip, I pressed a button, it went right into my expense report software, which then immediately went into our accounting system to be able to reimburse me for that trip. So that's a great example, I think, of what's happening on a day-to-day basis with us.
But that also raises a challenge on, if you think of what you just described and you think of what Brian described. In the case of Brian had 5 different systems to manage all that interaction, right? So there was one system for ordering goods. There was the same system maybe for managing receipts. But as soon as Brian got the invoice, guess what? The information that he had on one platform or 2 platforms did not translate to the system he was using to make payments, right? So in the case of a lot of ASCs, if you think of how you're cutting checks to your suppliers, the data you are submitting to your suppliers is very different from the data you have within the other platforms that you're using to manage your supplies. So I find in our personal consumer lives, if you compare what we do with what's happening in the ASC industry, there's a little bit of a disconnect. And I think at the heart of that is the lack of data from one platform, or the lack of integration of data across multiple platforms to create a consistent procurement experience in the ASC industry.
So why don't we just start by actually defining FinTech in a very concrete way for our listeners, and then we'll talk about how, I think you talked about how it works in business in general, but maybe talk a little bit about the current state of it in healthcare and ASCs. I mean, we talked earlier, for example, about the fact that in my business, I still get checks for the most part. I mean, we offer everything, but for the most part, I'm still getting checks.
Yeah, the way I view it in the ASC industry, there's a huge disconnect, John. I would not say we have gotten to a place of integrated fintech platforms within the healthcare industry. And when I say fintech, all I'm really describing is the use of technology to improve how ASCs manage and conduct financial transactions. That's really what I am describing. And the way I look at it as someone who's new to the ASC industry, I spent 20 plus years in the payments industry. And when I moved into the ASC industry, the thing that surprised me is just how systems are completely disconnected, right? In the sense that you use one system to catch your POs, maybe use the same system to manage receipts. But as soon as you get invoices, when it comes to making payments, you're basically shifting to a different platform. So when I look at the ASC industry, the first thing that strikes me is the way systems are completely disconnected, the lack of integration across systems. The other thing that I find quite interesting is the way the payment methods currently used within the ASCs, whether you are cutting a check or whether you are running an ACH transaction, or even if you're paying your suppliers with a credit card, there is an absolute lack of data to inform AR transactions for the suppliers, right? So one of the challenges I see beyond the lack of integration is the lack of data to inform what payment you're making and for what purpose and for what invoices, right? So the lack of data to help a supplier manage their accounts receivable operation is another gap I have seen within the payments, within the ASC industry. And the third gap I have seen, John, is really the lack of transparency, right? So if you're a CFO managing ASC operations, one of the things I see as a gap in how we currently run operations is you may not necessarily know what you owe at any given time, and you may not truly know how much money you have in your bank account. So when it comes to having transparency of financial information to make decisions, that's a third gap I am seeing that's currently existing in the ASC industry.
It seems to me that there's 2 concerns that we probably have. One is staffing, and one is just the efficiency of that cycle. They're kind of tied together. But, right now, post-pandemic and arguably even pre-pandemic, we're having a hard time finding staff for our surgery center. It's not just our nursing staff. It's not just our clinical staff, but the business office staff too. So what you've described is a way of perhaps reducing staff at the same time that you're improving the quality of that transaction cycle. And what I mean by that is improving the reliability of information. You want to make sure that you're only paying for products that you actually ordered at a price that you agreed to and that you actually received that product.
Yes, John. And what I would also add to what we believe is a strong value proposition for ASCs to embrace FinTech, it's hard cost and opportunity cost. There are hard costs with mailing checks and the labor associated with it. Then there are a lot of opportunity costs, I think, as you're describing, right? If you can utilize fully integrated technologies that reduce hard cost, right, such as checks, and reduce the work of your staff so they can focus on other high value efforts in the organization, there's opportunity cost there, right? So, for example, if you can use a simple technology that takes only a few seconds to schedule payments and it manages getting those payments to the suppliers fully reconciled on their statements so that that same supplier also does not shut you off because a paper check is in the mail for 2 weeks and not fully reconciled. One can imagine that could free up potentially a few hours every time there's an issue with transacting business with a supplier and focus on analyzing the rich data that FinTech can provide you to make better business decisions in this current environment. So we also believe those costs paired with staffing shortages, as you've pointed out, and just the rising cost of business that is putting margin pressures on ASCs is another reason why FinTech can really help the ASC industry and all industries in general.
So where do you think we're heading with FinTech? And I do need to point out that FinTech sounds like a trade name, and it is not. It's a term that we're using here. I believe there's actually a couple companies out there with the name FinTech. So a little bit of our caution to our listeners here that we're talking about a term and which we have previously defined here. But where are we heading? Where do you think it's going, especially in the healthcare industry and specifically ASCs?
So when I think of ASCs, I see us heading to a world that will have three characteristics, if I can call them that, right? The first characteristics is we are heading to a world where you get tools or information to make better business decisions, right? Tools that give you the transparency of what you owe, transparency of how much money you have, transparency of how you can actually make payments to run your business. So that's one characteristic of what the future is going to look like. The other characteristics is convenience. Convenience in the sense that you will essentially have a world where you can click on one button and your suppliers get paid, irrespective of how the suppliers want to receive that transaction, right? Some may want it to be received the same day, some may want it to schedule for a different time. Irrespective of all the options the supplier may have, for you as an ASC, you will get the convenience of essentially clicking on one button and managing payment to all your suppliers with the reconciliation data the supplier needs to run their businesses as well. The third characteristic I see for the future is control, in the sense that for you as an ASC, if you think of how you need to manage your cash flows and how you need to manage your operation, the tools available within the FinTech industry will allow you to control when and how you make payments and will allow you to basically run your business in a much better way.
No, John, I 100% agree. And John, I think there's another element of this that you have taught me really well over the last year. And that is, how will the data, right, in FinTech, that rich data, how will that help the banking industry provide new product to the healthcare market and the ASC market, and particularly new products in this interest rate constrained environment that will help ASCs, grow, whether it's capital lines of financing. I think there's some significant opportunities there that, John, you can speak to.
Yeah. I mean, because if you really think at the end of the day, right, if you're a bank, your job is to manage risk. And for you to manage risk, what you really need is very clear data for you to be able to understand how a business is operating. And one of the things I find within the ASC industry is the amount of data that is currently available in terms of what you're buying, what you're actually consuming within your operations and within your business, as well as how you're managing your cash flows. That is very meaningful data for the banking ecosystem, because if you are to make a decision on what to extend John's ASC in terms of whether it's working capital financing or other type of lending products, that type of data just based on your daily operations for you as an ASC can actually help a bank create a product that's very specific and made for you in a way that you're actually not paying extremely high interest rates. Because if you think of what informs a rate that you're getting from a banking institution, a lot of the times it's really based on what they know about you, right? So the more they know about you, the more they have visibility into your operations, the more they have clarity into how you're managing your AP, the better they can be able to work with you to refine your operations, to refine the type of lending products they extend to you. And the fact that we can create a way to make that data available to the banking ecosystem without you needing to open up your platforms as an ASC is a tool that I think will be extremely important in how the banking world and the ASCs of the future work together, right? So I do think, to the point my colleague is making, just the ability for us to create a pipe that allows communication between the banking world in the US and the ASCs in the US for banking world to appreciate and understand the data being used to manage ASC operation will help us introduce products that make it easier for you as an ASC administrator to run your business. And the bottom line, it will actually save you money.
So just to make that clear, because that's a great example or a great insight there, is that right now those systems are completely separate. You purchase a product, you write a check, you send it off. In the meantime, you're maintaining a bank account, you're reconciling the bank account. You might end up at the end of the month needing to borrow money, so you go out on a line of credit, or you go back and borrow money from, or not borrow money, but you get the doctors to fork in some more money if the bank's not going to extend you credit. Maybe you're, a brand new facility, or people are using their own credit cards, or you have a company credit card. And think about the complexity there of all of those different systems that you're using in order to pay for product, but they're not at all integrated and requires an enormous amount of time for you to reconcile.
And that's precisely, and I can give you an example from my prior life where I think FinTech will enormous benefits, right? There are those occasional situations where you need a quick working line of capital, a bridge loan, for example, whether it's a piece of equipment, because your claims are on delay or something along those lines. Traditionally, right, you just reach out to the banks because it is a process. It takes time and effort to actually fill out the applications, etc. If you think about in your personal life, you can go to the likes of websites like Lending Club, etc., right? And you can quickly get 5, 6, 7 options back pretty quickly because they have your FICO score, for example. I can imagine a future where if I was an ASC operator in that situation, almost like my personal life, I would immediately get access to multiple offers, right, that really help me identify the exact product for that need at that moment, almost real time, compared to hoping I have the right Rolodex of banks to call and the time to fill out application. I feel like that for an ASC operator can be a game changer in those situations where they just need some bridge capital.
And especially the fact that as an ASC operator, you don't actually have to manage all those relationships. You have a partner who understands the ASC industry and is willing to manage those relationships on your behalf. To me, is a game changer, right? I mean, unfortunately, we also what happened with Silicon Valley Bank. Imagine if you're an ASC and the only relationship you had was with Silicon Valley Bank, right? But to my colleague's point, if you have a partner who has a network of banking partners that can create resiliency to the ecosystem. So even if one banking partner moves out, you're not actually concerned as an ASC administrator because the bridge line of financing that you need will always be guaranteed given the pool of lending partners that are available. I think is very, very important.
Sure. I'm going to give you an example of something that just happened yesterday with one of our clients, and maybe you can describe how FinTech could have helped this situation. So I get a phone call at 8 o'clock in the morning saying that their defibrillator failed its test. And they had no backup defibrillator, no AED. And the first question that was asked of me was, can I still do surgery? And of course, my first answer was, no, you've got to stop immediately. And by the way, this was a GI center. So all of those patients had already prepped for the procedure. And just imagine, now imagine that you don't have enough money in the bank for whatever, for the dollar amount of that transaction that you're going to have, let alone the issue of trying to find a defibrillator very quickly. I'm just kind of putting you on the spot here. Can you kind of discuss using that as an example as to how much easier it would be to solve that problem in the world that you're describing here?
Yeah. And I'll use the lens of a finance person, and then I will ask my colleague to use the lens of an administrator. Because in my scenario, when I look at that example you just gave, John, imagine a world where you were able, as the particular customer you're describing, to order a defibrillator that comes in maybe that afternoon or the next day with a guaranteed line of credit to that supplier just for that piece of equipment, not necessarily you opening a relationship with a bank for a monthly line of credit. But imagine if you had an extended line of credit just to buy the piece of equipment you need for that particular use case, and the ability, let's say, to expedite shipping with some of the supplier partners that we have. And then as you're doing the surgeries and as you actually get money coming into your ASC, then you can pay off the piece of equipment as you need to. Imagine if you had that flexibility within your ASC world.
And what I would add to that is if you think about the comments you made, John, around identifying a defibrillator, even finding somebody with it, right? You may have established supply relationships with lines of credit, but in the event that the only way you can get the defibrillator is some vendor you've never worked with that requires you to go through a typical credit process because defibrillators are a dollar value that requires that. Imagine in our world, in a fintech world, where you essentially can do COD, right? Because you're using a lending product to get cash and immediately pay for it and bypass that credit process with a new vendor and getting what you need, that defibrillator, shipped immediately and available so that you can take care of your patients. So I think there's a lot of real world examples in which having access to real-time capital and cash in a pinch like that can solve your problems.
I want to go back to a comment that was made and kind of just float off your tongues, but we didn't talk about it. And that is the question that all of the owners of these surgery centers are going to ask is this going to save me money? And if so, how?
So let me say this. What I would say as an administrator, if I think about examples of buying new pieces of equipment, right, whether it be a C-arm or some image-guided system for your ENT cases that are a few $100,000, often you are going to be buying that on some type of financing program, often financed through relationships with whoever the capital organization is selling that to you. In that specific example, having the data that my colleague has described to use to identify other funding sources with the best rate will absolutely give you opportunities to save money. Or if money is not the issue, also help you find the right terms for cash flow, right? Whether it's, financing over 3 years and 5 years, because cash flow is more important than the total cost of acquisition. What it will do is give you all of the options, right? In that example, acquiring capital, to make the best business decision. Again, whether that's cash flow management or it's cost savings. But I'm pretty confident to say the rich data will help, as John, my colleague, will describe, the banking industry provide you savings opportunities.
Yeah, and to my colleague's point, if you think about it, right, there are 3 ways it can actually save you money, right? One is the better data will always result into better rates, right? The more I know about you, the more I can calculate risk, the better terms I can give you. That's one. The second one is also the fact that we are working with multiple partners. And in a sense, if you're in the lending business, they almost have to compete for your business in a way, right? Because if you have one banking partner versus, let's call it 50 banking partners competing for your business, the more competition you have, the better it will be for ASC owners. And the third one is what my colleague described in terms of all the efficiencies, all the way from procurement to you actually making the payment. All those efficiencies do actually result in hard dollars in your pocket at the end of the day, right? So the quality of the data will result in better rates, which is one way will save you money. The fact that we are working with multiple partners will save you more money due to the fact that they'll have to compete for your business. And all the efficiencies we are introducing from supply chain to payment will save you hard dollars as an ASC owner.
So I'm going to look at you, Brian. You were an administrator. I'll also point out that I've, up until today, we're recording about noon today, I think I've spent my entire morning on at least 15 different websites managing my own business, not even an ASC, not even as complicated as an ASC, going into my bank transaction, my payroll, my, I had to purchase some items today. I had to interact with my employees in a couple different platforms. Describe the day of the typical administrator and what we're talking about. How is the typical administrator's day going to change if they're able to adopt this new technology?
Great question, John. And I'm gonna describe something I've described to my colleague John here several times. I had a particular surgery center on the West Coast that every Friday, for example, I would sit in a conference room for about 4 hours with my finance team and payables team with a printout from our accounting system of our current liabilities, as well as a printout of information from our bank accounts in terms of what's our bank balance and a checking account and other assets we had. And then another printout, which is expected cash flows for revenue, right? And so for 4 hours, I'd be looking at all that and trying to prioritize, right? Who do I want to pay so I can continue to keep getting supplies? Try to take advantage of payment terms, right? Which vendors perhaps will give me discounts, which ones will charge me from late. And also try to balance entire cash flow to ensure that my physicians were getting distributions timely to stay engaged with the business, which is critical, right? 4 hours every Friday. What this should do is take that 4 hours and allow you to make real-time decisions, ideally daily, 10 minutes every day. At best, you have all the data, right, exposed seamlessly, allow you to make those business decisions that will accomplish that goal, right? How to pay your suppliers within the context of how you want to manage your cash flow and manage your business so your physicians are getting the distributions and are engaged with your business so it will thrive.
So can you give some examples of existing FinTech applications that are already out there? One comes to mind for me actually is Amazon. I think we talked about this a couple weeks ago. Great for ordering office supplies and things like that, but not so great when it comes to the medical field. But it is an example of one solution out there that definitely has revolutionized the procurement process.
So, and that's the challenge, John, right? And we don't have very good examples within the healthcare industry that we can point to. So we end up pointing to examples from the consumer world, right? And another example I will give you, similar to what my colleague described, is a product like Mint.com, that gives you a view into liabilities as well as money you have for your own personal life. So if you think of the 4 hours that my colleague had to spend every Friday morning in terms of thinking through how much money they have, who they owe, and what payments they need to make. For your personal life, you have a product like Mint.com that's able to give you visibility into all of that, right? When it comes to payments, you have products like Apple Pay, you have products like Google Pay as an example, that are essentially making it easy for you to pay merchants, whether they're online merchants or physical merchants across the globe. So when I think of the challenges we are facing within the healthcare industry, is how do we make these concepts that have worked so well in the consumer fintech world and start introducing them to the products that are critical to how we run our healthcare operations within the ASC world. So unfortunately, I can't give you examples within the ASC healthcare world, except for one, which is triValence. Other than that, I have not seen any other company that's attempted to do what we are doing.
My point being, of course, is you're exactly right, is that why can't we have in business the same type of solutions that we have in our daily life? I keep, complaining about the fact that every time that I go to the Amazon site, I make one particular individual a lot richer. And I'm happy to pay for it because it does make my life so much simpler. So thankfully, and thanks for our sponsor, triValence, there is a solution out there. So why don't you tell us what that solution is?
Similar to your Amazon experience, John, and I understand not wanting to make individuals wealthier, but similar to your Amazon experience with triValence, you can actually order from all your suppliers from one location, right? You can also get the visibility that I described that was similar to Mint.com in terms of what you owe your suppliers and how much money you have in your bank account. And we can give you visibility into what you owe per supplier if you want, right? So you get a dashboard that looks and feels very similar to what you'd get with Mint.com, with enough information for you to be able to make financial decisions for your company, right? The other thing you get from us is you get a one-click payment button that allows you to pay your suppliers without you needing to remember who accepts check or who wants what type of payment. So think of it as we're essentially moving away the complexity of you having to spend 4 hours every Friday morning trying to figure out how you're going to pay suppliers. And we give you visibility into how much money you have and how much you owe suppliers with one click button for you to actually be able to make all your payments as well. And soon, as we mentioned, we'll be introducing our ability for you to make payments, not just based on money you have in your account, but also money you're getting from some of our lending partners as well.
John, and that's an incredible description of our product. And I think one of the other values that our solution provides to our customers, and this is similar to your own personal life, the deep integrations that we're building. So you can seamlessly integrate to all, close to 30,000 banks in the United States. We can integrate with your accounting platforms. If you think about in your personal life, the term onboarding or implementation, right, that doesn't exist. If you go to mint.com, for example, you literally sign up for mint.com and then you provide your credentials for all your banking institution, and mint.com does the rest of the work for you. The platform we've developed has the same philosophy with our integrations. So you really get that seamless experience, but you get the same experience as you'd have in your consumer life, right? No lengthy implementation, really simple way to integrate with all the data points you need to get what John described. And I think that is a key differentiator. And I think that's really important in the ASC market that's constrained for resources, and many are also technology burnt out. How do you make it simple for them? And that is also what we're trying to bring to the market, a simple way to accomplish what my colleague John has described.
And I believe you have an offer for our listeners.
John, we have 3 levels of our product, but the product that we'd love to have your listeners take a look at is our professional product, which is a free product as a starting solution to ASCs that are mostly paper-based or would like to start with basic supplier and fintech capabilities, to enter this market. And you can go right onto our website, sign up for that, and we can onboard you, enroll you, and get you started with basic functionality and one-touch payment within a few weeks.
And we'll provide a link to that. And I did want to emphasize the word free. There are upgraded versions. There's different versions, just like you could have with, say Amazon again. But your base product is free, and once you try it out, you can see this in action. And as you said, there really isn't too much to the onboarding any more than going to the Walmart or the Amazon websites and looking around and then interacting with the website.
That's about it. It's probably 15 to 20 minutes of time of getting the data. And then regular touch points over the course of those two or 3 weeks that take no more than 30 minutes, and you're live and using the product. It's incredible. It's a great experience.
Brian and John, I want to thank you. This was a great conversation. I know that most of our listeners are probably never even heard of the term fintech, and you did a great job of describing what it is. And I hope we got the message across that it can save you money, save you time, and provide a safer platform for making sure that we're only paying for the products that we actually ordered and actually received, as well as making our lives easier and reducing the amount of complexity in our payment systems, procurement and payment systems.
Thank you so much. Thank you for having us.
In this segment, we provide an update on upcoming topics for the podcast, our upcoming virtual conferences, and upcoming speaking engagements for John and his staff and other events in the ASC industry.
So the ASC 2023 Conference and Expo is coming up May 17th through the 20th, 2023 at the Kentucky International Convention Center in Louisville, Kentucky. Sue, we're coming with a pretty large contingent, I think between 9 and 10 people from Ambulatory Healthcare Strategies, and of course the entire team from the podcast here. We're going to be doing a couple episodes, we anticipate, during the conference. We always have fun getting together and talking about things going on. Sometimes we're able to get them out actually during the conference, and sometimes we have to wait until afterwards. But expect a wonderful time there, and I think there's still time to sign up for the conference, though it's getting pretty close at this point. And Sue, you and I are actually deciding to drive to Louisville, so that should be a fun 13-hour drive. But looking forward to seeing all of you there. And certainly as you see us during the conference, step up to us and introduce yourself. We'd love to hear from you.
And the Arizona Ambulatory Surgery Centers Association's annual conference and exhibits is June 22nd to the 23rd, 2023 at the JW Marriott Camelback Inn Resort and Spa in Scottsdale, Arizona.
And the Florida Society of Ambulatory Surgical Centers annual conference and trade show is July 19th through 21st at the Lowe's Portofino Bay Hotel Universal Orlando.
The Ohio Association of Ambulatory Surgery Centers annual education conference and exhibition is September 19th through the 20th at the Hilton Polaris in Columbus, Ohio.
And we, of course, will be there in force, and we'll be doing a special episode from there also. And the Idaho Ambulatory Surgery Association's annual conference is September 21st to the 22nd at the Hilton Garden Inn in Boise, downtown. And don't forget about our upcoming boot camps. As we mentioned, the May Director of Nursing Boot Camp will be May 30th through June 2nd, 2023, presented virtually. And, of course, all of our boot camps include much more than just that 4-day conference, including access to a lot of resources, weekly drop-in sessions, etc. And the multi-state conference is June 12th and 13th, 2023. It's free to members of various state associations and patron members, and it's a very reasonable $299.99 for anybody that is not a member. And the July Administrators Boot Camp is July 11th through 14th, 2023, presented virtually also. And the August Business Office Manager Boot Camp is going to be August 8th through the 11th, 2023. For information about any of these boot camps and our multi-state conference, visit us at ascpodcast.com.
And also, don't forget about our recorded events. They're all available on ascpodcast.com. We have a credentialing conference, the Fall 2022 Finance and Accounting Conference, Conditions for Coverage Conference, the Medical Director Conference, and the On-Demand Director of Nursing and Administrator Boot Camps.
And we always want to remind you to become a patron member of the ASC Podcast. It is an exclusive membership website that provides a one-stop ASC regulatory and accreditation compliance, operations, and financial management resource for busy administrators, nurse managers, and business office managers. And resources include some of our virtual conferences, links to various resources, policies and procedures, forms, drills, and discounts on services and books, and access to AEU credits. Membership helps to defray the cost of producing the podcast, including our research staff, travel costs to conferences, equipment costs, and production costs. And for more information, you can visit us at ascpodcast.com. Thank you for tuning in to this episode of the ASC Podcast with John Goehle. We hope you found the discussion informative and engaging. If you did, we encourage you to share it with your friends and colleagues in the ASC industry. And don't forget to hit that subscribe button so you never miss an episode. We'd like to give a special shout out to our amazing team who make this podcast possible. Our sound editor, Susan Cronkite, our executive producer, John Goehle, and our dedicated research team, Jenna Alvarez, Judy D'Ambrosio, Alex Borneman, Zach Caloritis, Amy Durbano, Lori Rodricks, Kathy Foti, Donna Macchio, Ann Geyer, and Diana Powell. We couldn't do it without them. Our music is provided by Media Sushi and Mike Noah, and the ASC Podcast with John Goehle is hosted on Podbean and is available on all major podcast platforms. We look forward to bringing you more exciting discussions and insights in future episodes. Thanks for listening.
This episode of the ASC Podcast with John Goehle is sponsored by triValence. triValence offers a comprehensive next-generation ASC solution that optimizes payment and supply chain performance, enabling actionable data insights. For more information about triValence, visit their website at trivalence.com. That's trivalence.com. This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.